A very good question. How would we plan health care for everybody? Well, let me just say, in my day, there was virtually health care for no one except a small number of merchant seamen. In 1798, the first governmental insurance program was put online, which provided a certain number of hospitals so merchant seamen could, when they came to port, get medical care. That was as comprehensive as your government plan was in 1798. Just a small number of people that were in need of care. Medical care was the responsibility of the family. It was the responsibility, I suppose, to a lesser extent of the institutions in the community that could provide a certain amount of resource to people that were in need of them. We did not see it as a job of the government. In fact, there are many things that you have today that we did not see as the job of government. I think Social Security was well beyond our purview. It's interesting, in 1794 there was a revolt in Haiti, in Santo Domingo, and a great many refugees came to American ports to escape its ravages. They were mostly French people, and they were clogging certain port cities like Baltimore. And the government of Maryland petitioned the federal government and said, we've got to do something to help these people. We have all these refugees. They had to leave without any of their wealth or their personal items. We've got to help them, and it's beyond our own ability. And there was a really intense debate that took place in Congress, especially in the House of Representatives, over whether it could be done or not, whether it should be done or not. One of the congressmen, a man named Elias Boudinot, who was a founder of the American Bible Society later on, a stalwart, religious human being, said, I see in our Constitution the cry that we help these people. And James Madison, who had helped write the Constitution, who knew it perhaps better than anyone else, said, I want to help them as much as you do, but I am looking in my mind for anything in that document which allows us the right to do that. Another man, a Virginian, Mr. Nicholas, said, well, if you brought it to a vote today, I would vote for it. I would feel compelled to vote to aid these people. But then I would have to go home to my constituents, and I would have to apologize to them for having overstepped my bounds. We struggled in the early days of this country to know what we should do for our fellow human beings. It wasn't that no one cared. It's just that the social compact which had brought us together, the Constitution of the United States of America, didn't provide us with the opportunities or the right that we could clearly see to do these kinds of things. Now, in your day, a great deal has changed. I mean, I think you would be disappointed in a government which would not help people. I think many of you were disappointed in our government after the hurricane struck New Orleans, that the government was so slow to respond to help the people. But let me tell you, if that had happened while I was alive, the only response there would have been local people bringing what they could bring, relatives and family members helping in the only ways that they could, churches doing what was possible. There would be no governmental response. So I have not answered your question, sir. How would I put together a program like that? I would think that we would probably need a constitutional amendment. We would have to have all citizens of the United States of America answer on such a referendum what was needed. Only a constitutional amendment would explain such a dramatic reshaping of what we believe to be our social compact. So I urge you to try that if you are interested in a health care plan for all citizens of the United States of America. Thank you for your question.